It remains a priority to further build our testing abilities, in part to understand the presence and spread of COVID-19 across the state. In our last testing announcement on the 24th, we were running about 2,000 tests per day across our 3 state labs, our 4 commercial labs, and our 15 hospital labs. Today, we're now averaging around 4,000 tests per day. And in total, we have now run nearly 28,000 tests here in Illinois, with 30 hospital and clinical laboratories now up and running. Within the next 10 days, we believe that we will be up to 10,000 tests per day. Again, we're at 4,000 today. That marker, 10,000, is significant because it's the number of tests per day that the scientists and experts tell us that we need to get a truly holistic understanding of the virus in each of our 102 counties. Right now, we're working with roughly the same data that the majority of states are working with. That gives our state a rough picture of the virus's landscape across our state and in our municipalities by extrapolating the data using modeling largely based on the virus's spread in other countries. This 10,000 a day marker will give us the data to run a more mathematically significant model that offers us improved insight into how well our interventions are working. Ultimately, my goal is to reach a large enough testing capacity where we're able to test everyone who needs a test on a regular basis. But for right now, all of the experts point to 10,000 tests as the standard that we need to achieve. Again, I want to be frank with you. Where we are now is not where I want to be. Every day we aren't hitting 10,000 tests or more is another day that we're not able to get answers that help us get past this current crisis. And to be clear, the loss of essentially the entire month of February in the effort to scale up robust testing and the exponential spread that followed was a profound failing of the federal government. State leaders have spent every day since then trying to correct for this foundational mistake. Nationally, there have been some improvements in testing, but we still have so far to go. The United States is still trailing other countries in testing on a per capita basis, several times over. In all the states, we are working to fill the gap. But the most frustrating part of this gap is it's not just in the past. The White House has promised millions of tests for weeks now, and they're just not here. To be clear, I also welcome the testing capacity when it actually arrives. But I'm not going to wait on promises from the federal government that may never be fulfilled. We need this testing capacity now, so we're building it ourselves in Illinois. Here's how we're getting there. All 3 of our state labs are running a second shift of technicians to run samples, and we'll be adding a 3rd shift when we can get our hands on an even larger supply of the reagent and viral transport media and other material elements needed beyond the swabs themselves. Second, and this is key, we're acquiring additional laboratory robotics to load our 12 real-time PCR machines at a multi-thousand unit increase in single-day capacity. We're getting our first 2 machines on loan, and we'll have them up and running by Tuesday, and we expect the others later this week. This technology is crucial as it replaces manual loading and shrinks down the bottleneck for results. We're working with the University of Illinois Discovery Partners Institute to ensure our staffing and logistics reflects this increased capacity, as well as exploring options with the Illinois State Police to utilize their manpower to move materials and equipment to maximize daily capacity at each of our 3 state labs. You also might have heard that Friday, Abbott Laboratories, an Illinois company, announced a portable 5-minute rapid test for COVID-19. That same night, I picked up the phone and I spoke with the president of Abbott and the CEO of Abbott separately to ask that Illinois be first in line. I'm proud to say that they expressed their real dedication to taking care of their home state and will be very helpful to us here in Illinois as their production ramps up. In a parallel effort, we're collaborating with our university and hospital partners to ensure Illinois' commercial testing can grow as fast as possible. As for our drive-through testing, we've added a fifth facility since our last testing update. The Illinois National Guard, really, truly an amazing group. The Illinois National Guard has opened up a second state-run drive-through testing facility in McLean County yesterday, joining our Harwood Heights community-based testing site in northwest Chicago and the 3 federal HHS sites in Bolingbrook, North Lake, and Joliet. Our state-run sites have been a huge success, and in addition to our McLean County site, we're investigating additional areas around the state to launch potential drive-through locations. Symptomatic first responders, healthcare workers, seniors, and all people with underlying health conditions will be able to visit these sites. Still, due to the federal government requiring federal personnel representation at our 2 state drive-throughs, we remain tied to a 250 test cap at each of these locations. We know there's greater need. At our longer-running Harwood Heights site, we've been hitting 250 tests by just the early afternoon and having to turn people away. We'd like to be able to test more than 400 people a day at these sites and think that we can. We have the capacity to do so. So we're pushing the federal government to change their requirements and allow us to test more than 250 people. We're turning people away that we just shouldn't have to, and we ask the federal government to remove their restriction. We're also pressuring the federal government on the return timelines of these tests. The private labs contracted by the federal government are taking 4 to 7 days, and sometimes even up to 10 days, to turn around results. That is far too long. We're doing it much faster in the state of Illinois with the capacity that we have. Of course, we can't just test, we have to treat. And in order to treat people, we have to increase hospital bed capacity. In the daily updates over the next few days, I'll talk more about our acquisition of PPE, personal protective equipment, and our work to increase hospital capacity around the state. Of course, hospital capacity means nothing without the heroes who staff these facilities. Healthcare workers and first responders are stepping up, working day and night, and they are saving lives. So I want to end this with a message for Illinois' landlords who lease to our medical professionals. We're seeing news stories out of other states about nurses being thrown out of apartments or denied the ability to rent their apartments out of fear of exposure by other tenants. We've not yet specifically heard of instances like that here in Illinois, but let me be very clear. That will not be tolerated in our state. I want to remind everyone that evictions are prohibited during this disaster to begin with. But I also want to make sure that landlords are not inappropriately terminating leases. So let me say this. Here in Illinois, we are fortunate to have a very strong community of attorneys that are ready to fight for nurses and for all healthcare workers to make sure that their rights are protected. If any healthcare workers encounter this situation, they should immediately contact the Lawyers Committee for Civil Rights under Law for assistance. Thank you, and now I'd like to turn it over to Dr. Ezike from the Department of Public Health.
Thank you, sir. Today, I am reporting 1,105 new cases and 18 additional deaths. There are now more than 4,500 cases in Illinois, including 65 deaths. As the governor mentioned, additional testing can help us better understand the amount of virus circulating in our community. There are many who are ill with only mild, minimal symptoms who still may be unknowingly transmitting this virus to some of our most vulnerable populations and introducing it into vulnerable congregate settings. These settings already face additional challenges when it comes to the spread of an infectious disease. They incorporate many components into a single physical location, including housing, food service, healthcare, and workplace. There are many opportunities for COVID-19 to be introduced into and spread throughout these facilities, and with quite a rapid pace. In long-term care facilities, there's constant foot traffic, from staff reporting to work to residents going out for medical visits. This movement allows for the virus to be introduced into and spread throughout the facility. The Illinois Department of Public Health has been working with nursing homes and other long-term care facilities on infection control practices. We're also working on increased health screenings, both for the residents and for the staff, and isolation and quarantine guidance. These exact same challenges exist for correctional centers. As a former medical director in a correctional facility, I know all too well about the traffic of staff going in and out of the facilities daily, detained individuals leaving for court appearances, and the rate of turnover. All of these commingle and increase the rate of infection and its fast spread through these facilities. The Illinois Department of Corrections is taking a number of steps to control the spread of COVID-19 in its correctional centers. Among those steps that are being employed are increasing the provision of hand sanitizer, increasing the use of antibacterial soap, and ensuring that cleaning supplies are adequate to all staff and for the detained individuals. The health of these individuals is critical, and we must closely monitor and institute isolation and quarantine measures whenever necessary. When multiple cases of COVID-19 are identified in a long-term care facility or a correctional center, testing everyone who resides or works in the facilities might not be indicated, but as more testing is available, that will give us the options to test as required. The physicians on site will assess and identify those who need the testing. More testing available across the board will better inform the amount of virus that we're seeing in the community, where we can take that information and identify specific concerted efforts to decrease the risk in those high-risk areas, ultimately with the goal of limiting infection, limiting spread, and ultimately limiting lives lost. This is how we will get to the end of this pandemic sooner. And now I will summarize these points for our Spanish-speaking population. Con un corazón pesado, estoy reportando 1,105 casos nuevos y 18 muertes adicionales. Ahora hay más de 4,500 casos en Illinois, incluyendo 165 muertes. Como dijo el gobernador, las pruebas adicionales pueden ayudarnos a comprender mejor la cantidad de virus que circula en nuestra comunidad. Hay muchos que solo tendrán síntomas muy mínimas, muy bajas, pero son estas personas que pueden transmitir el virus a nuestras poblaciones más vulnerables o los espacios congregados. Hay muchas oportunidades para que COVID-19 se introduzca y se extienda en estas instalaciones. En los asilos de ancianos hay gente entrando y saliendo. Los trabajadores que reportan trabajar hasta los residentes que van a citas médicas. Este movimiento permite que el virus se introduzca y se propague por todo el edificio. El Departamento de Salud Pública en Illinois está trabajando con asilos de ancianos y otros centros de en prácticas de control de infecciones y exámenes de salud para residentes y personal. Los mismos riesgos existen para los centros correccionales. El Departamento de Correcciones de Illinois está tomando medidas para controlar la transmisión de COVID-19 en sus centros correccionales. Estas vidas son importantes también. Estamos vigilando la salud de personas en estos lugares y estamos implementando medidas de cuarentena cuando sea necesario. Sin embargo, teniendo más pruebas disponibles informará la cantidad de virus que estamos viendo en la comunidad. Esto nos permite identificar dónde se tiene más infección. Después podemos enviar más recursos allí y luego podemos poner fin a esta pandemia. Les pide que continúen.
You've been watching an update from Governor Pritzker in Chicago. In case you didn't catch the whole thing, we want to run through some key points here. The Director of Public Health for Illinois says that there are 1,005 new cases, 18 new deaths in the state. That brings the death toll for Illinois to 65 and the case number to about 4,500. Now, the governor spoke on two main points. The first about testing. He says right now there are about 4,000 tests being administered in the state. He's hoping over the next few days to get that number up to 10,000 so that the state has a better idea of how the virus is affecting the state of Illinois. He says they're working with companies, universities, and hospitals to get those tests made in Illinois and given to the people who need them. He also had a message for landlords, saying that there have been quite a few reports of healthcare workers who are having issues with their landlords, finding that their leases are being terminated. He says the state has no tolerance for that, and he's asking any healthcare worker in Illinois who's having that problem to reach out to the state. He says there are attorneys who are prepared to fight for them. We are going to keep you updated on the latest with our COVID-19 coverage. You can tune in on our app, online, and right here at 5 o'clock.
Spectrum Mobile is a better way to mobile. First, we deliver the fastest overall speeds and the most reliable mobile service, coast to coast. Now, we're bringing you 5G, and it's only going to get better. We're extending our network every day so we can offer you the best experience. That means faster speeds, so you can do whatever you want, wherever you are. 5G is here. Spectrum Mobile.
Think Chris Offenberg Ford Lincoln and think savings. A special announcement from Chris Offenberg Ford Lincoln in Washington. To assist with the financial impact of current events, we are announcing immediate financing and payment deferral options at our Washington location. Beginning immediately, 0% APR financing for 84 months will be available, and payments will be deferred for 120 days. Chris Offenberg Ford Lincoln in Washington. We are in this together.
American Kitchen has truly become the heart of our homes. It's where we nourish and nurture, celebrate, and live. At Signature Kitchen and Bath, we know you can see the kitchen of your dreams, but let Signature's design experts bring it to life before your eyes. See exactly what your new kitchen will look like and use our design plan to make it real. Signature's design consultation is complimentary and commitment-free, so dream big. Put your unique signature on the heart of your home. Visit Signature Kitchen and Bath today.
We now return to our regularly scheduled programming already in progress.
So Cooch heads to the 7th with fond memories of this par 3 as it's time now for Like It Never Even Happened, presented by ServPro. But we promise you this did happen last year in this championship at this 7th hole. Cooch had a 3-iron from 181 yards out. And when it landed, he knew that it was on line, but did it have enough roll for the ace? There's your answer. Cooch raising the roof at ACC. Like it never even